Could we hear from Matt Schweich? Did I pronounce that right, Matt? Jacqueline, you're next.
Chairman, members of the committee, thank you for the opportunity to testify today. My name is Matthew Schweich, not the first to mispronounce, don't worry, and I am the Director of State Campaigns for the Marijuana Policy Project. Before I jump into my prepared testimony, I want to touch on two topics related to Maine and Massachusetts. I was the campaign director for the Yes on 1 campaign in Maine, campaign director for the Yes on 4 campaign in Massachusetts. You heard testimony earlier suggesting that there's still a technicality in the Maine law. That's not the case. While it is true that there was an argument to be made that due to complexities in the Maine legal code, a skilled lawyer might have been able to argue that the law made marijuana legal for youths, that was quickly rectified by the Maine legislature in legislation passed in January. And you also heard a characterization of nothing happening in Maine. Maine is moving ahead with legalization. There's a bill that's being given serious consideration that will provide $1.6 million in funding and is also making changes to the regulatory structure. So things are moving ahead in Maine. Earlier you heard comments describing the Massachusetts referendum as something voters did not know about, but that's not the case. I lived through it. Op-eds, LTEs, half-hour, hour-long TV interviews, forums, debates, Facebook comments, emails, calls we got. Voters vetted that law. They knew that it established a system for regulating and taxing marijuana. The leading ad against question 4 in Massachusetts was all about whether people wanted marijuana in their communities. It was an ad saying that you're going to have a whole bunch of stores if you vote yes on this initiative. So the characterization that Massachusetts voters had no concept of local control when they voted yes on that initiative, it's just not true. I'm going to run through a few reasons why the General Assembly should pass legislation this year to legalize, regulate, and tax marijuana. I'm here in favor of H 5555. One, it is the fair and just policy decision. Marijuana is less harmful than alcohol. It causes less violent behavior, including domestic violence. It is not possible to overdose on marijuana, but it is possible to overdose on alcohol. It doesn't make sense to punish adults who choose the less harmful option. Laws should be consistent and fair to the greatest degree possible, and with regards to marijuana and alcohol, that is not the case in Rhode Island. Two, it serves the interests of public health and safety. Right now, otherwise law-abiding Rhode Islanders are being forced into an unregulated market where there's no guarantee that the products are being tested for safety. Furthermore, the unregulated market exposes these Rhode Islanders to more dangerous substances by putting marijuana sales in the hands of dealers. If you visit a marijuana retail establishment in any legal state, you will not be offered harder drugs. If you buy marijuana in Rhode Island today, there's a decent chance that you will. I heard the stories earlier from the parents who went through struggles with their children, and that affects me, and I have the same goal as them, to solve that problem. In my mind, the solution is taking marijuana out of the unregulated market, being sold by people who don't care whether you have an ID, who don't care about the quality of the product, and putting it behind the counters of licensed and tax-paying businesses. Those businesses will check IDs. They have a strong disincentive to avoid selling to underage people. And so part of its regulation, the other part is let's open up some revenue so we can fund substance abuse programs targeted at teens. If we want to bring down teen use, if we want to prevent teens from being exposed to drugs, we need to fund programs that do that. This law will provide such funding. The third reason, this will create jobs and generate investment. There will be jobs directly created by retail locations, cultivation facilities, and product testing facilities, and there is a multiplier effect. Legalization will provide work to a range of existing businesses, including construction companies, electricians, plumbers, HVAC specialists, security firms, compliance firms, and real estate advisors. We need those jobs, and we need that economic activity in Rhode Island. Four, it will create a significant new source of revenue that can be used to fund important public programs. Washington State expects $730 million in marijuana tax revenue over the next 2 years. Roughly 60% of those funds will be allocated to public health. Colorado has already distributed $220 million in marijuana tax revenue, including $118 million for school construction. That's in just 2 fiscal years. In both states, enforcement costs have represented a small fraction of total marijuana tax revenue allocations. 5, this is an issue of social justice. White Americans and African Americans use marijuana at roughly the same rate, yet African Americans are disproportionately punished for marijuana offenses. That's been the case in Rhode Island and across New England, even after decriminalization policies are passed. Simply put, legalizing marijuana eliminates a broken policy through which prejudicial treatment of minorities manifests itself. 6, Massachusetts is moving ahead with legalization. You may have heard about delays, and it's true the legislature delayed retail sales to July 2018. But Senate President Rosenberg has promised publicly not to further delay implementation of the law. The reality is that next summer there's going to be stores opening in Massachusetts, very close to our state, likely on the border. And Rhode Islanders are simply going to drive across the border, and they're going to bring back marijuana, while leaving behind, to the benefit of the people of Massachusetts, all the tax revenue, all the jobs, all the economic activity. I want to touch on 2 other points raised. The 7th reason is it's working elsewhere. The gentleman from Project SAM earlier talked about back-of-the-envelope calculations. We don't need back-of-the-envelope calculations because we have numbers straight from the state governments of Washington and Colorado. The notion that costs are exceeding revenues is a demonstrably false assertion. I can provide you with a document from Legislative Counsel in Colorado that actually has a line-item breakdown of where all the marijuana tax revenue is being spent. And it really ranges on a spectrum. Some of it is being spent directly on enforcement, hiring people to oversee regulation, less than 10%, $16 million out of $220 million, to be example, to put that in context. And then you've got kind of a range of programs. Some have absolutely nothing to do with marijuana: school construction, anti-bullying, dropout prevention. Then you have some funding for programs that are kind of in a gray area: substance abuse, public health programs, community health centers. My point on that kind of spending is legalization did not create the need for those public programs. Legalization created a way to actually fund them, to fund programs that are dealing with problems that exist whether or not marijuana is legal. The difference is when you legalize it, you have money to address those problems. 8, the tobacco comparisons I keep hearing are deeply flawed. We heard earlier this notion that the General Assembly could be liable. My understanding of tobacco settlements is it's tobacco companies paying those settlements, not the governments that allowed tobacco use. So in the same way, if theoretically there was some kind of settlement, it would not be the General Assembly being liable, it would be the company selling. But to that point of this big marijuana myth, the reality is big marijuana can't occur because we live through big tobacco. What was big tobacco? It was misleading the public about the dangers of cigarette smoking. It was luring children in with certain forms of advertising. So we learned those lessons. This legislation prohibits that kind of behavior. You heard Representative Slater at the start talk about all the different forms of advertising prohibited by this legislation. So this notion that big marijuana is going to go out and spread these lies, how are they going to do it? It's going to be illegal under Rhode Island law. Last point is on medical access, and this was a big issue in the Massachusetts campaign. The reality is that there are some people that don't want to go through a program, they don't want to be on a list, they don't want to deal with the process, they don't have the money to cover the expense, but they have a medical need for marijuana. In my work, I've met some people, it's changed me. I mean, I've met a child who can open his hand, who has cerebral palsy, that couldn't open their hand before. I met people who suffered horrible seizure disorders, epilepsy, people with brain tumors. Medical marijuana is a question of right or wrong. I believe recreational marijuana is good public policy, but medical marijuana is a question of right and wrong. But one of the benefits of taxing and regulating marijuana is it gives certain people who don't want to go through a medical program, who don't want to be on a list, it gives them a way to access medicine. So to conclude, given that Massachusetts is moving ahead, given that even opponents acknowledge that legalization is inevitable in Rhode Island, given that a majority of Rhode Island voters, a strong majority, want a legalization policy, given that this policy serves the interests of public health and safety, given that we need the jobs and revenue, the common sense approach is to pass legislation in Rhode Island this year and begin the process of establishing rules and regulations. Thank you again for taking my testimony.
Thank you, Matthew. Any questions? Representative O'Grady.
Thanks. Thank you, Matthew. Just one question. You mentioned you were the state campaign director in Massachusetts for the Yes on 4 campaign. I'm curious, as I recall, the final tally on that vote was about 54% supportive, 46% opposed. Can you tell me how closely those results tracked the polling data that you saw leading into that election?
They tracked very closely, largely because we paid for very expensive pollsters. But yes, I mean, the support we saw in the polling we did, the polling that was conducted by the media, whether it was the Boston Globe or internal polling, it did show a level of support in the mid-50s. And so the final result did match what we expected to see. Similarly in Maine, the polling, it was a much closer vote. We won by 5,000 votes in Maine, and the polling suggested it was going to be closer there. And our polling here, and we do this polling in multiple states, and in my experience, you know, the polling data we see is generally accurate. We did a poll earlier this year, and it showed 59% of Rhode Islanders support legalization.
Okay, and that's why I asked the question. Because clearly you had done those polls prior to both the Yes on 4 and Yes on 1 campaigns, I guess, in Maine, and those results tracked well to the election results in both those cases.
Absolutely.
Okay. All right, thank you.
Thank you, Matthew.